Hello guys, in our this series of presenting the hypothetical cases for your practice regarding your board exams, we are here with one case in ethical dilemmas which may occur or which may evolve in the dental practice where someone feels that something is not good, but at times they feel that how to proceed, how to confront that situation, how to take the decision, and they may go through the ethical distress. So let's start now. This situation, you are working in a busy multi-specialty clinic. In this clinic, you are reportable to the practice manager. And patients are also assigned to you and the other dentists who are working over there by the practice manager. Your practice manager is asking you to take radiographs every 12 months of those patients who are covered by the insurance, like mandatory. They say that it is mandatory to take the x-rays of those patients. In your opinion, this is not appropriate to take x-ray of every single patient merely on the basis that they are covered by the insurance. So what would you do in this situation, or how will you handle this situation? First of all, let's analyze the situation. The ethical and clinical concerns related to this condition. The rationale for prescribing radiographs, we have to firstly look into that. It is important to consider why a radiograph is being prescribed in patient's case. And to prescribe a radiograph, certain questions should be answered. Why this radiograph is being prescribed, or those radiographs are being prescribed. What is the reason? What is the indication? What would be the number of the radiographs taken? Like only periapical x-rays or a full mouth x-ray or maybe an OPG or whatever. Then what would be the amount of exposure which we may put the patient to? How much time lapsed since the last x-rays were taken? That is also very important. And are those x-rays still of any value or not? If not, then we will take the appropriate action. If they are still valid, then our course of action will be different. And what are the risks to take the radiograph in that particular patient? And what are the benefits? And if the risks are more as compared to the benefit, or if the benefits are more as compared to the risks. Well, we being professionals, we are in the compliance of certain rules and regulations. Our professional commitment is that we are in compliance with the Health Canada Safety Code 30. Then we have to follow the LRA principle, means as low as reasonably achievable, and according to that we have to go for the prescription radiography. A dentist must review the patient's health history and complete a clinical examination before prescribing radiographs. X-rays should not be ordered unless there is a specific and valid clinical reason to have them carried out. So that is based on the ethical principles of non-maleficence and beneficence. A dentist should not place a standing order of radiographs during recall appointments because taking of radiographs requires a patient-specific prescription. However, a dentist can prescribe radiographs for a subsequent appointment to follow up on a previously detected condition or pathology, or to confirm a diagnosis or evaluate the treatment provided. Like in case of some endodontic procedure, So just to see if the rarefaction is now subsiding or not, or during the treatment when we take the radiograph in order to see if the canal is fully obturated or in order to evaluate the working length. Similarly, in case of some residual root, if the root has been fractured while extracting a tooth, etc., etc. So the dentist should document the prescription for future radiographs in the patient's chart. According to the Royal College of Dental Surgeons of Ontario, their guidelines of 2022. Now let's see what is this safety code 30. There are four main aspects of radiation protection to be considered in dental radiography, and that the first one that is of utmost importance. So at the moment we will be just emphasizing on that because that is concerned to our today's topic. Patients should not be subjected to unnecessary radiographic imaging procedures. This means that the procedures are ordered with justification and when the diagnostic information cannot be obtained otherwise. Very, very important point. We know the ethical principles. Now let's apply those ethical principles to this situation. Patient's autonomy. The patient has the right to refuse a treatment, including having a dental radiograph. Therefore, if on recall visit or the annual visits or 6-monthly visit, there is no justifiable need for a radiograph carried out, patient can refuse to have a radiograph taken. Patient's autonomy also extends here to inform the patient to their dental condition and the need for the dental X-ray, its value in diagnosis if it is required, and the consequences and risks if X-rays are not performed. Like if it is necessary, we have to tell them. Non-maleficence. The do no harm principle applies to radiology as unnecessary exposure to radiation is not considered in the benefit of the patient. Any X-ray taken should be justified. Before any X-rays are taken, it is important to verify if there are any recent dental X-rays available or the accurate diagnosis depends on it. I have already mentioned about that. If avoiding the X-ray risks provision of inferior treatment, then we have to convince the patient, inform the patient and tell them that it is required. If the patient decides not to go ahead with the X-ray, then we have to put it in the patient's records. Then comes beneficence. If X-ray is required and patient is having an progressing disease like patient is at an increased risk of developing the caries or the caries are there and chances are that they may progress. Patient is having some periodontal condition and chances are that it may have progressed in the last 12 months. So we have to take the successive radiographs in order to monitor that problem. Justice. Consider before proceeding that if it is justifiable to take an X-ray unnecessarily just on the basis that the insurance will pay for the X-ray, that is not correct. If the patient is at a higher risk of developing or rapidly progressing in a current or potential disease condition, as I told you regarding the caries or periodontitis, the dentist may exercise discretion to have the patients regularly screened. However, in all other cases, if there is no clear indication for the need for a dental X-ray, it should not be performed. Veracity. We should be truthful in all the conditions. So truthfulness towards performing any procedure. If it is not required, we will be in direct conflict of this rule of ethics, that is veracity. How to handle the situation? What would be our decision? The practice manager must be educated about the various laws and regulations indicating that X-rays should not be prescribed on a routine basis unnecessarily. Patients should only be advised regular X-rays if the patient has a presenting complaint that requires emergency resolution. Patient presents with a dental condition that may be poorly diagnosed without an X-ray, or its progression or the improvement, whatever has done in the last 6 months or 12 months, then we have to take the X-ray. Patient presents with multiple presentations requiring discrimination and identification of original cause of disease. Patient is undergoing treatment requiring regular reviews. For example, they are having orthodontic treatment, reconstructive procedures for cleft lip and palate, growth modifications, cancer treatment screening, etc., etc. And I have already mentioned about the caries and periodontal diseases. In all other cases where there is no clinical indication, the X-rays should not be carried out regardless of patient having insurance or not. Similarly, in case of implant, like if you have placed the implant and you are waiting for the implant to be osseointegrated and you need to take the X-ray, then you have to take the X-ray. Or in case of a failing implant, you feel that you need to see what is the amount of bone destruction, then you can take the radiograph. So over here we are done with our this case or this presentation, and I will come back to you with other presentations, and I am thankful to my team members who helped me in making and presenting this presentation. Your feedback is always very, very important to us. Thank you very much.